today we will be discussing the last question paper that was attempted by you, and I will try to explain the reason of correct answer. And if you want to ask any question, you can also ask. So the first question was, which of the following condition is suitable for KMC, kangaroo mother care? First one was, just try to learn from the KMC what is the basic concept of KMC. KMC is meant for those babies who are low birth weight, as they cannot maintain their body temperature. So obviously a child who is sick and ill and is in the incubator or under the warmer, you cannot then start KMC, because the child needs active treatment, therapeutic treatment, injections, IV fluids. So only a low birth weight baby who is hemodynamically stable, that child can be started the KMC, right? Second is, so correct answer is C. Most common causative organism in neonatal septicemia in India. So in the developing countries, the common organism responsible for causing the neonatal septicemia is E. coli. This you can remember, that the first choice will be C here. Now coming to the APT test. What is APT test? I give you a clinical example that will make you understand better. Let us say a child delivery took place in your hospital, and you have handed over the child to the mother, and the same night at midnight the attendant of the child reports that the child has passed blood in the vomitus. उसने उल्टी में खून आ गया या बच्चे की पॉटी में खून आ रहा है, right? So naturally the parents are very worried for this condition. Now what you will do? So to make the things clear, what you will do the APT test, because the blood the child is passing in the stools or in the vomitus. First is that it may be the child's own blood. There is some problem inside the GIT and the child is passing blood. Second possibility can be that the child has swallowed the mother's blood and now it has vomited out that blood. So what you will do the APT test. What is this APT test? This is a alkaline denaturation test, and the fetal hemoglobin which is present in the newborn, that is resistant to alkali to the neutralizing effect of the alkali, whereas the adult hemoglobin that changes color with alkali. So what will happen? What you will do? You will take the sample of the blood or the vomitus and you will dissolve it in water. What will happen? The RBCs in the blood, they will break down. Hemoglobin will be released. You will centrifuge it, and the supernatant you will find it is pink colored. What you will do? You will mix the alkali, sodium hydroxide, into this solution. Now if the color remains pink, this means the blood is of the newborn's origin. But if turns brown or yellow, this means it is from the mother's womb. So if by doing this test, if the color changes, you can then pacify the mother and attendants that no need to worry. During the process of delivery or afterwards, maybe some cracked nipple, etc., the child has swallowed mother's blood which the child has vomited. But if it remains pink, this will be a point of further investigation. So this is about the F test. So here the correct answer will be B, that is swallowed blood syndrome. Is it clear? Now coming to the fifth point, the manifestations of hypocalcemia in neonate except. Neonate में hypocalcemia तो क्या होगा, जिट्रीनेस भी हो सकती है. If the calcium level falls further, उसको सीजर्स भी हो सकती हैं, हाई पिच क्राई भी हो सकती है. कार्पोपीडल स्पाज्म दो a feature of hypocalcemia, but it occurs in the adults. In the newborn ये कार्पोपीडल स्पाज्म का साइन नहीं आता. So the correct answer will be C. Now coming to the pneumatosis intestinalis is produced by bacteria in the bowel, is a radiological sign for which condition? It is the NEC, necrotizing enterocolitis. What happens in the wall of the intestine? If you say on the X-rays, what will happen? Let us say this is the wall of intestine, and here you will find gas in the wall of intestine. This is called pneumatosis intestinalis. So the correct answer is B, necrotizing enterocolitis. In neonatal sepsis cases, fatality rate is highest for. The correct answer is Pseudomonas. Pseudomonas aeruginosa. The correct is Pseudomonas aeruginosa. You can note down because the fatality rate is highest with this organism, and you have to use the higher end antibiotics for this. Therapeutic effect of phototherapy depends on following factors except. So this also needs to be learned. Let us say the child has got neonatal jaundice and you have started the phototherapy. So जो phototherapy का effect है किसके ऊपर डिपेंड करेगा? जस्ट ट्राई टू अंडरस्टैंड कि जो लाइट है उसकी वेवलेंथ क्या है, लाइट और बच्चे के बीच में डिस्टेंस क्या है. अब आपने बच्चे को क्लोथ ही पहना दिए और डाल दिया तो लाइट का जो इफेक्ट है नहीं आएगा. मीनिंग देयर बाई द बॉडी एरिया फॉर विच इरेडिएशन इज़ अवेलेबल, उससे फ़र्क पड़ेगा कि कितना उसका बिलीरुबिन कम होगा या नहीं होगा. दैट्स वाई ओनली ए स्मॉल डायपर एंड टू ए कवर फॉर द आईज इज रिकमेंडेड व्हेन यू आर डूइंग द phototherapy. The child is naked in the phototherapy unit. So जो hemolysis है उसके ऊपर नहीं डिपेंड करेगा. So here the answer is D, rate of hemolysis. A poor prognostic sign of congenital diaphragmatic hernia is. इसका क्या है कि just try to understand. Let us say this is the diaphragm and this is the diaphragmatic hernia. Now if more and more GIT contents they go inside the lungs, then early respiratory distress will start. So the correct answer here is for this the early respiratory distress within 6 hours of life C. If the congenital diaphragmatic hernia, the extent of this is not much, then let us say only this much is herniating, then the respiratory distress will not be there or it will take place later on. So single umbilical artery in a newborn increases the risk for, this is the renal anomaly. When we were discussing the newborn examination, if you remember, I told you if there is a, what is there in the umbilical cord, if you cut, there are 2 arteries and 1 vein, right? So if there is a single artery, then chances are that the child may be having renal anomaly also, right? So one of the following drugs may cause pyloric stenosis if administered to a premature infant. The answer is erythromycin. It is known to cause this pyloric stenosis if given in to the premature and early neonatal period. That's why it is not used below 6 months of age. Neonatal hypocalcemia. This is common in, the answer to this is that all of the above. It is common in preterm baby also, in infants of diabetic mother also, and the patient newborns who have got birth asphyxia. So in all these conditions the child may be having hypocalcemia. Normal Apgar score is 7 to 10. The 7 to 4 is mild birth asphyxia and 1 to 4 is severe birth asphyxia. So those who have answered 1 to 3 means they have no idea what Apgar score is. In physiological jaundice, direct bilirubin level should be, so the correct answer is A. What is the pathophysiology of this? In the newborn, there are more RBCs. Hemoglobin is to the tune of 17, 16. So, with the birth of the child, these RBCs, they start breaking down. So, more of the hemoglobin is released and it is broken down into the hemoglobin is broken down. More of the bilirubin is just concentrate here, you will understand more of bilirubin is released. Which is this bilirubin? This is indirect. Indirect means it is not soluble, right? So what happens? This bilirubin will go to the liver, and in the liver it gets converted into direct bilirubin, or also known as, this direct is also known as soluble. It is excreted into the intestines and excreted out. This is the normal mechanism. Now, as more and more hemoglobin is broken down, this is released, right? So, some of this is converted by the liver into the direct bilirubin and that is excreted. But as this is more and the capacity of liver is less, so what happens? These levels start rising up. But this direct bilirubin remains in its normal range, right? So if this direct, how will this rise? If there is some blockage here, it is not excreted, then it will also increase. So the level of direct, if it is more than 2, then this means it is less than 2 in physiological jaundice, and if it is more than 2, then we will call it as pathological jaundice. Is it clear? Should I repeat? Anyone? So the next is breast milk jaundice. This is due to these two, pregnanidiol and free fatty acids in the mother's milk. These two are responsible for breast milk jaundice. In the post-term infant, which of these features is common? All the three are. As the child has become post-mature, maturity has increased, the lanugo, long nails and vernix caseosa will absent. Physiological jaundice in newborn occurs after 2-3 days. As I have told you, this hemoglobin starts breaking down. The RBC start breaking down, so it starts increasing. If it is present at birth, this means the hemolysis has already started in utero. पेट के अंदर जब बच्चा था वहीं पे स्टार्ट हो गया, and that is usually pathological, not physiological, right? So by birth, within 24 hours and 10 days, all these indicate pathological jaundice, not physiological. In asymptomatic term neonate, hypoglycemia is defined as less than 45 mg/%. The least well-defined long-term sequelae of severe prolonged hypoglycemia. बच्चा न्यू बॉर्न होया, उसको हाइपोग्लाइसीमिया हो गया, नो बॉडी नोटिस, नो बॉडी गेव ट्रीटमेंट, इट कंटिन्यूड, मदर ने भी कोई खास नोटिस नहीं किया, एंड इट रिमेन्ड अनट्रीटेड. तो लॉन्ग टर्म में उसमें क्या आएगा? इट कैन बी पर्सनैलिटी अफेक्शन. उसकी पर्सनैलिटी में आम नॉर्मल बंदे से डिफरेंस रहेगा इफ़ द चाइल्ड हैज़ सफर्ड hypoglycemia during the neonatal period. Sunset sign. This is found in hydrocephalus, right? And convulsions at the first day of birth, it is due to birth asphyxia. During the process of delivery, if the child, you are not able to revive, the child has got birth asphyxia, the child has delayed cry, then convulsions can also occur. In the infants of diabetic mother, the following are true except. क्या है? डायबिटिक मदर है तो हाइपोग्लाइसीमिया के चांसेस बहुत होते हैं, इसमें हार्ट फेलियर के भी होने के चांसेस हैं, एंड द इंसिडेंस ऑफ कंजेनिटल अनोमलीज इज आल्सो इंक्रीज्ड एज the child is born to diabetic mothers. This increased weight of placenta and infant organs is not correct. So the answer here is B. Bilirubin level of which milligram% manifests as clinical jaundice in neonates? It is more than 5. So the correct answer is A. Dose of vitamin D in preterm is 400 international units. Rooting and sucking reflex, as we discussed in the reflexes, it is 34 weeks, right? So if you want to ask any question, you can ask. Anything you want to ask?